Welcome to Podcast, the Business of Dentistry podcast, brought to you by Practice Plan. Podcast delivers the best business advice, real-life stories, and practical hints and tips to make your practice a more profitable and sustainable business. And now, here's your host.
Hello, my name's Nigel Jones. I'm one of the directors of the Practice Plan group of companies. That includes Practice Plan DBS and Medenta. And welcome to this latest edition of the In the Loupe series of podcasts that I have been creating for a little while, where I normally get the chance to talk to movers and shakers in the world of dentistry, hopefully to provide some useful information or at least some thought-provoking content for listeners. And today's going to be a little bit different. I'm just going to give my personal views on what's been a flurry of announcements over the last 2 or 3 weeks, and just sort of quickly summarize what I've taken away as the key points, knowing that for an awful lot of you, time is of the essence, and it's quite difficult to create time to do things like listen to the 2 to 3 hours worth of video content relating to the Health and Social Care Committee that happened a couple of weeks ago. So this is my attempt to try and summarize that for you, and obviously flavour that with my own take on things. So what were the 3 things that were of particular note? So that there is a small additional one which I will mention, but the 3 things are the publication of the 10-year plan for the NHS. Then a few days later, the publication of consultation on changes to the current contract for dentists in England, with a view to implementing those changes in April 26. And then the day after that was the latest instalment in the hearings of the Health and Social Care Committee, focusing on NHS dentistry. Now, I should say at this point that all 3 of these developments relate to England. I mentioned that in terms of the consultation on the change to the current contract. So the 10-year plan focuses on England, the consultation focuses on England, and the Health and Social Care Committee focused on England. There's obviously quite a lot happening in Wales at the moment, and a different contractual framework in Northern Ireland and in Scotland. But the purposes of this podcast is to look at what's been happening in relation to England. So let's start with the 10-year plan for the NHS, about 178 pages as far as I can tell, and 1.5 pages dedicated to dentistry, which I think some might interpret as being symbolic of its relative importance. There also wasn't even a mention of dentistry in the foreword written by the Prime Minister. So I think that's quite an interesting little observation, but in a way not too surprising, because it's very, very clear both from the original diagnosis done by Lord Darcy, but then also in this 10-year plan for the NHS, the scale of the challenge that exists in making sure that the NHS can survive and perform a valuable service in the decades ahead. So it's a big challenge. It's not too surprising then that the dentistry is given relatively little focus. But what focus there was, I think points towards some of the priorities which were then re-emphasised in the consultation and in the committee hearing. But the key elements that were in the 10-year plan included a renewed commitment to the provision of the 700,000 urgent care appointments per year. And I think the per year is quite an important point just to be clear about. There was this reference to the minimum 3-year tie-in to the NHS after graduation for dental graduates. This is obviously something that they consulted on and have been thinking about for quite some time. And within the 10-year plan was a commitment to introducing that. There was reference to the need for a focus on prevention and improved access for children. And that was going to be achieved through better use of dental therapists, but then also more fluoride varnish and fissure sealant applications, and of course the supervised toothbrushing programs in schools that this has been mentioned. There was also a reference to fluoridation of water supplies. They then did trail the fact that there would be changes announced to the existing NHS dental contract, so changes working within the broad contractual framework that exists in England at the moment. And as I mentioned, this emphasis that they would be introduced in April 26th, dependent on the outcome of the consultation. But in addition to that, they made a very real distinction between those changes and what they described as fundamental contract reform. And the 10-year plan says that the commencement of the process of fundamental contract reform would happen later this year. And then the final point I mention is that something, a theme going right the way through the report, the 10-year plan, is this concept of neighbourhood health services. And there was a specific reference to the role that dentistry, NHS dentistry, would play in those neighbourhood health services. So it's not excluded from that. It will definitely be weaved into whatever form those end up taking. So yeah, so that was the 10-year plan. And then, as I say, a few days later, one of the points that had been highlighted in the 10-year plan, then we were given more detail on, which was the launch of the consultation on the changes to the existing contract. Some of this reinforced points that had been referenced in the 10-year plan, such as mandating a proportion of the current contract to be dedicated to unscheduled care, and then associated that would be enhancements to payments is the proposal to make it more attractive for NHS dentists to dedicate a proportion of their time to emergencies. There was what I think many people would think of as a very welcome change suggested, which was the creation of new pathways and additional payments to encourage the provision of care for patients with complex needs. We know there's been a disincentive, given the way the UDA contract is currently structured, to see people with multiple treatment needs. So I think the creation of these new pathways is very much a positive step forward. And then, in addition, there was the proposal of creation of incentives for the application of the fluoride varnish and Fisher sealants that have been mentioned in the 10-year plan, and then extending the reach of those preventive measures to allow nurses with extended duties and hygienists and therapists to be involved. So again, trying to remove those barriers. There was some references to exploring options to support reducing clinically unnecessary checkups. That's their language. And that's nothing particularly new. We're seeing Wales focus on that a bit more at the moment. But I suspect that this concept of needing to create capacity by removing what is perceived to be clinically unnecessary appointments, that's something that's probably going to gather momentum again. And then some other bits and bobs to do with financial incentives around annual appraisals, that kind of thing. So I think generally the view of that seems to be it's a positive step forward, but it is only a step in what's going to be a very, very long journey. And I think that what really matters is the fundamental contract reform. This may buy them a little bit of time to focus on what the fundamental contract reform could look like, but I think you can't really do much other than to welcome it. I mean, the mandating of a proportion of time for emergencies may be a little bit more contentious and might vary from practice to practice in its desirability, but the essence of this is something that's to be welcomed, I think. And then the following day was the Health and Social Care Committee's hearing, and this was divided into two sessions. The first session included representation from the BDA, Nuffield Trust and Health Watch, and they pretty much restated a lot of the issues and the challenges that we're pretty much all familiar with, I think. The only thing that I would particularly pick out of their contributions, helpful though they all were, was the specifics relating to funding, with the BDA, Shipavari, saying that we needed at least £1 billion of additional funding to take us back to how the NHS was 10 years ago for dentistry. And even then, we know it was under an awful lot of challenge. So just to get back a decade, we need at least £1 billion. And I think that was a figure that the person from the Nuffield Trust agreed with, but she also went on to say that in order to get a universal dental healthcare system, we would need billions in the plural. So I think between a billion and billions, I think that the point was well made that a lot of additional funding is really needed to restore the service in its current format. Now, I mentioned that because sitting in the audience listening to that was Stephen Kinnock, who's the Minister of State for Care, who has responsibility for dentistry. And he then went on to play the starring role in the second half of the committee hearing. He was accompanied by people from Department of Health and from NHS England, and also Jason Wong as the CDO. So it was mostly dominated, I would say, by the minister's contribution to proceedings. And I think the best way of bringing that side, I would say it was quite an impressive performance by the minister. Certainly among the most impressive that I witnessed in my time in dentistry. And I thought he handled what was also some fairly robust questions. I think the evidence of the BDA's lobbying of MPs, particularly those on the committee, and helping them understand exactly what is involved in the challenges with NHS dentistry. I think that was very evident in the way that they asked the minister questions and were pinning him down on actually very pertinent points. It's quite a reassuring thing from a democratic perspective to watch proceedings, really. But I thought he stood up to that interrogation quite well, although what he was saying, I think, has some very real significance that is worth thinking about. So, for example, he was asked about details of the tie-in of graduates for 3 years after the NHS, and what he clarified was that they would not be expected to spend 100% of the time on the NHS. But he went on to say that it was not yet possible to determine exactly what proportion of their time, and he linked the answering of that question to fundamental contract reform. And he acknowledged the fact that actually trying to introduce a tie-in of graduates to a system that you haven't reformed when everyone else has acknowledged for many, many years that it needs that fundamental reform, that didn't seem quite right. So actually the tie-in of graduates needed to go hand in hand with clarity over what the future contractual structure would look like. So then inevitably the questions from the committee were around what are the timescales for embarking on that fundamental contract reform, and he confirmed that it would have to take place within this parliamentary term. He used the phrase NHS Dentistry's burning platform, and therefore there was a need for urgency to get things moving, and that was his commitment that it would happen in this parliamentary term. And when again further pressed as to when the negotiations on this contract reform would begin, he said he was hoping it would be in the autumn, but that it would be dependent on confirmation of the financial envelope that was going to be made available for NHS dentistry as a result of the comprehensive spending review that was announced earlier on in the year. And that, he said, that share of the funding that would be made available, he said, should be confirmed at the end of the summer 2025. So you can see this sort of sequencing of events that we need to clarify what the budget is, and then knowing what the budget is can kickstart the contract negotiations. And then that unlocks the answers to a whole load of questions that will have arisen from the last couple of weeks worth of announcements. Now, it was very interesting to hear him say that the reality of the world we live in is that we should not expect the financial envelope for dentistry to be much different to where it is now. And of course, I think that's particularly significant when you bear in mind the points from the first half of the committee hearing, which was that we need at least $1 billion, if not billions, to restore the service. So the fact that that is very unlikely to happen, I think, is quite a key confirmation. Probably no surprise to anyone at all, but interesting to hear it confirmed. And that he went on to say that therefore they will have to identify priorities in line with the financial reality of the budget allocation. And he used the phrase, we will have to cut our cloth accordingly on a few occasions, which again is I think a refreshing degree of honesty. The sense of priority that you got from some of his earlier contributions was to do with urgent care, which makes sense, sort of an urgent care safety net for the whole population. And then he spoke about the need to use whatever budget allocation there is to create a service that had the maximum impact for people in most need. And in this sort of context, I think the definition of the word need was partly clinical, but also partly ability to pay. So you've got this sort of overall sense that perhaps they're looking towards some kind of rationing of who's got access to NHS care. I mean, that's me speculating, but obviously, inevitably, the words core service spring to mind when you hear some of the challenges that are going on there. He did get asked a question about about workforce, and he made the point about the fact that the strategic purpose of NHS dentistry needed to be agreed before you could determine what workforce needs you had. And again, that makes perfect sense. And you can understand how the strategic purpose has to go hand in hand with confirmation of whatever budget is available. So those two things make perfect sense. But on the specifics of workforce, he spoke about having tasked the GDC with addressing the 5,000 internationally qualified dentists currently waiting to get put on the register due to the backlog with OREs. And that he was expecting them to come back to him in September with a proposal for how they were going to clear that backlog. Now, I suspect that that's something that is not necessarily an action the GDC will find easy to do. I suspect the procurement process isn't entirely straightforward. And even if that gets sorted, then actually working your way through that backlog will take time. So it'll be interesting to watch that one. And then there's all the issues around mentoring and supervision. How practically are we going to be able to do that with people that have qualified overseas? So there's quite a lot of questions there, even if I think the minister felt that there was a real opportunity there. He did also mention the development of programs for training of more therapists. And again, I think that's quite an important thing, but I suspect that isn't going to be necessarily the quickest and most straightforward thing to make reality. And then there's also the challenge of the fact that I know of loads of private practices that are looking for therapists. So how do you create enough incentive for these new therapists to work within the NHS? And that obviously brings into question things like access to NHS pensions and some additional cost that I guess has got to be factored into that spending within the financial envelope that was mentioned. But I think this point about strategic purpose is probably a really important thing, because you then have to sort of come back to actually what is that purpose. And in my mind, I think it should be about reducing oral health inequality, and it should be about how do we blend together the NHS and private provision of dentistry in a way that achieves that aim. So it may be that we, over the coming months, hear a few more ideas around that. How can that best be achieved? I mean, yes, within that, you've got to look at payment models, and there was some talk about the weighted capitation approach favoured by the BDA and how that had a dampening effect on access and activity when it was piloted in the last decade. Sessional payments, fee per item approaches, or some kind of blend of or several different approaches. So that's all going to be in there. But I think the key question is going to be, is that going to be a contractual framework that is available to the entire population, which seems unlikely given the references to finite resources, or is it one that's going to be targeted at those groups most in need? So yeah, very, very interesting few weeks. Some more definite things than others. But I think an indication of a direction of travel that will potentially take us to somewhere that I think is much more sustainable and does allow us to have an NHS dental service going forward. But it will be interesting to see. We've got obviously some important developments over the next few months, and some very important developments over the next few years. So we will continue to watch and hopefully keep everyone updated. So many thanks for listening.